This amendment would simply ensure that as we address what has rightly been called an epidemic, we consider the unique impacts and issues of drug addiction for minority communities by adding an expert on minority health to the task force that is created by this bill. The dangers of opiate addiction are apparent across the board. Abuse of prescription opioids has contributed to a flood of cheap heroin to all communities. Over the past 4 years, we have seen a 269% increase in heroin overdose deaths in white communities, but also a 213% in black communities, a 137% increase in Latino communities, and 236% in Native American communities. With that in mind, it's important to remember that the opiate epidemic, both heroin and its prescription painkiller counterparts, looks very different from the perspective of communities of color. The compassion and clemency that we're showing now and the evidence-based solutions we are embracing were needed long ago, way before abuse spiked in predominantly white and suburban communities. As we craft the tools to solve this crisis, we must ensure the policies we create will help everyone affected. Adding an expert in minority health to this task force helps to make sure that the diverse needs of all Americans are represented at the table. We still live in a world of significant biases. Just last month, the University of Virginia released a study that found that white medical students and residents genuinely believed that black patients were less sensitive to pain and had less sensitive nerve endings than white patients, bearing out at least one reason for the consistently documented lack of pain management provided to black patients. As we give this task force the vital task of improving how we prescribe some of the most powerful and still critical medication for pain management, let's do our part to eliminate as much bias as possible. This amendment takes an important step toward reaching that goal, and I hope my colleagues would support that. I reserve the balance of my time.
The gentlelady from New Jersey reserves her time. Anyone seek recognition in opposition of the amendment? For what purposes does the gentlelady from Indiana seek recognition?
Mr. Chairman, I claim time in opposition, but I support the amendment.
The lady from Indiana is recognized.
I'd like to thank the gentlelady from New Jersey for this important addition to the task force. I think that she has brought forth some interesting points and some statistics with respect to the opioid abuse and addiction problems facing the minority community, and a minority health expert that is very focused on this would add tremendous expertise to the depth of this task force. And so with that, I support the amendment and yield back.
Gentlelady yields back her time. The gentlelady from New Jersey is recognized.
Thank you. I thank the gentlelady from Indiana for her leadership and for her support of this initiative. Let me close by adding this. We are considering a number of bills this week aimed at curing the opiate and heroin epidemics ravaging so many American families. And as we do so, we need to consider two things. First is that communities of color have unique needs and that deserve just as much consideration. That's why I've offered this amendment, and it's a theme I hope to see continued in other legislation we'll debate. The second is that when we head back to our districts on Friday after completing consideration of these bills, we should not wash our hands and walk away from this issue. We need to fund the programs we've authorized. We need to look back with a critical eye at the ways we criminalized addictions in the past and offer those who we failed solutions that will allow them to re-enter society. Or our work cannot stop there. I urge my colleagues to support this amendment, and with that, I yield back the balance of my time.
Gentlelady yields back her time. The question is on the amendment offered by the gentlelady from New Jersey, Ms. Watson Coleman. Those in favor say aye. Those opposed, no. Opinion of the chair, the ayes have it. The amendment is agreed to.